Health Tech's Your Health Now. Coronavirus, also known as COVID-19, is striking fear in the hearts of everyone around the world. As public health leaders and scientists frantically race to develop a vaccine and effective treatment against this terrifying pathogen, thousands of terrified people are clearing store shelves of hand sanitizers, antibacterial, hand soap, water, and even toilet paper. Are we facing the zombie apocalypse? Is this fear warranted? Should we be scared? Should we be concerned? There is a lot that we don't know about this virus. Are we facing a virus that is as devastating as the H1N1 flu virus that killed over 50 million people around the world in 1918? Or is this outbreak going to fizzle out like the 2014 to 2016 Ebola outbreak, which killed over 11,000 people in Africa and 2 people in the United States? Scientists and public health experts are working hard to find more answers. In the world of public health, almost no virus provokes greater fear than Ebola fever. An exotic agent that originated in Central Africa in 1976, Ebola kills between 50% and 90% of its victims, making Ebola one of the deadliest pathogens in the world. Viruses that kill their host quickly usually don't thrive well. Unfortunately for Ebola, the virus is so efficient at killing its host, it does not have a chance to spread as efficiently as viruses that are spread through aerosol droplets, which include coughs or sneezes. In many respects, however, COVID-19, with a death rate of around 2%, is deadlier than the dreaded Ebola virus. This fact should concern us. Ebola does not spread through aerosol droplets. Again, coughs and sneezes. A fortunate reality. Otherwise, Ebola would be capable of wiping out the entire world in short order. Instead, Ebola spreads through direct contact with body fluids, which includes blood, semen, feces, saliva, tears, and urine. In other words, Ebola is much harder to contract than COVID-19, which means COVID-19 will infect more people around the world than the Ebola virus, making it a public health threat that will be difficult to contain. COVID-19 spreads much easily, or in other words, more easily than Ebola, making it a greater threat. COVID-19 spreads through aerosol droplets, coughs and sneezes, and by touching contaminated objects such as a computer keyboard, light switches, and doorknobs, as well as our beloved cell phones. Unlike Ebola, COVID-19 has mastered the art of propagating itself. This virus is designed to survive and thrive. It will probably stay with us for some time. So what is COVID-19? Coronavirus disease 2019, or COVID-19, is a virus, more specifically a coronavirus, identified as a cause of an outbreak of respiratory illness first detected in Wuhan, China. Like all pathogens, COVID-19 does not recognize borders. It is spreading around the world. The virus has emerged in Japan, South Korea, Italy, Australia, Finland, Germany, Canada, and now the US. It will continue spreading around the world. There are several types of coronavirus. Some cause the common cold, some, cause the deadly respiratory infections such as SARS, which stands for Severe Acute Respiratory Syndrome, and MERS, which is the Middle East Respiratory Syndrome. Unfortunately for many, COVID-19 is not the common cold, and it appears to be more virulent than the flu. Though these numbers are changing quickly, there are 647 known cases in the United States. 30 Americans have died so far, with numbers expected to climb to uncertain levels. Symptoms can range from mild to severe. COVID-19 produces symptoms associated with the common cold and the flu, making early diagnosis difficult considering we are still in cold and flu season and we are entering allergy season. Some patients who have experienced a mild form of COVID-19 report experiencing nasal congestion, running nose, and sneezing, which are all common cold-like symptoms. Other symptoms such as extreme fatigue, body aches, and a fever are commonly associated with the flu. So, what are the distinguishing symptoms of COVID-19? Once again, fever, cough, and shortness of breath. The shortness of breath and difficulty breathing are the trademark symptoms of this virus. Call your doctor if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread or ongoing community spread of COVID-19. When these trademark symptoms appear, many healthcare providers are conducting telephone appointments with their patients, reducing the possibility of infecting others in hospital, emergency departments, and doctor's office waiting rooms. Unless advised to do so, avoid rushing to the doctor unless you're experiencing life-threatening difficulties. In reality, public health officials truly do not know how many Americans are infected with the virus. It is possible that the virus has been silently spreading throughout the country over the past several weeks. And according to public health officials, it is possible to have the virus and not know, and then pass it along others, making this virus difficult to track. In fact, most people develop minor symptoms and fully recover. This is happening especially in our younger populations. In fact, there are no reported deaths for children below age 10. Therefore, school-aged children should not be overly frightened. While the deadly 1914 flu strain killed mostly young, healthy adults, COVID-19 is attacking older people above age 60 and people with chronic conditions with a vengeance. We can protect our older, more vulnerable loved ones, neighbors, and even ourselves by practicing social distancing. That is basically a public health practice that slows down the spread of a disease by taking certain non-medical precautions, such as self-quarantining when we are sick, avoiding contact with people who are sick, maintaining a distance of at least 3 distance between other people, and avoid shaking hands. You can do the Ebola bump instead, covering our mouths when we cough and sneezing into a tissue, as well as avoiding large crowds, which include concerts, crowded movie theaters, and crowded sporting events if possible. The most important precaution that we can take is to wash our hands with warm water and plain old-fashioned soap. There's no need for fancy antibacterial soaps, okay? And we should do that for approximately 20 seconds. Now, when washing our hands, be sure to wash the fingertips, the wrists, the palms, and the knuckles. When you are in a public restroom, try to avoid touching paper towel dispensers and doorknobs on the way out. It is a good idea to wash your hands whenever you arrive home and to basically just contaminate your, avoid contaminating your house. And use hand sanitizers only when hand washing is unavailable. Also, avoid touching your face with unwashed hands. These are the things that you should not do, okay? We should be concerned about COVID-19 and we should follow the recommendations from public health officials and healthcare providers to prevent the spread of this virus. However, like previous outbreaks, the media tends to provoke fear through its incessant reporting of COVID-19, causing unnecessary fear and panic. While it is important to stay informed on what is happening, we should remember that the media are in business to generate ratings, which in turn generate profits. So, what should we do to stay safe? Number 1, to practice social distancing. 2, wash hands frequently or use hand sanitizers when the washing facilities are unavailable. And also wash your hands before handling food and eating. Number 3, avoid contact with sick people when possible. Number 4, since your cell phone harbors germs, keep it clean by wiping it down with Clorox wipes. Keep other frequently used objects clean as well. Number 5, if sick, avoid contact with those who are at greater risk of complications, which include senior citizens and people with chronic health conditions, or people with diabetes, heart disease, and lung conditions. What also you shouldn't do is, number 1, according to the Surgeon General, there is no need to wear a mask in public if you are not sick. Stocking up on masks is creating shortages, making it harder for those who need them to get them. It is not a bad idea, however, to wear a mask if you are sick to protect others from your germs. Number two, while it is important to stock up in case of a lockdown, we need to be considerate of others who might need the basic necessities such as water, hand sanitizers, hand soaps, and toilet paper. Don't be a pig. Number three, avoid going to school or work if you feel sick. And number four, consult with your healthcare professional if you think you might have been exposed to COVID-19 or you are experiencing symptoms like a fever, coughing, and shortness of breath. Remember, if your healthcare professional might not want you to visit their office, hospital emergency department, he or she might conduct a phone appointment with you instead. This can protect you from contracting germs and protecting others from your germs. And be concerned, be safe, but don't panic. Our public health leaders and scientists are working diligently to contain the COVID-19 virus. I am community health worker Chien, and thank you so much for watching.